Thanks, Minister, and good morning. So as the Minister said, from Monday, state-run vaccination centres will administer the second dose of the Pfizer vaccine at least 6 weeks after the first dose. That does front-load the first doses for Victorians, allows more to receive that first dose of COVID-19 vaccine in coming weeks. One dose does give you strong protection, especially against COVID illness and against hospitalisation. And that change to 6 weeks is consistent with the ATAGI guidelines. The guidelines do recommend that the second dose of Pfizer should be administered between 3 and 6 weeks after the first dose to achieve optimal protection against COVID-19. But we have seen other countries safely and effectively use that longer dosing interval with Pfizer, including in the United Kingdom and in Canada, to allow many more people to get that first dose at an earlier time. And ATAGI advice does say that depending on the epidemiological circumstances in your state or around the country, you can make changes to that dosing interval within safe parameters. The change only applies to the state-run vaccination centres, as the Minister said. The Commonwealth vaccination providers, our GPs and Aboriginal community-controlled health organisations will continue to provide second doses at an interval of 3 weeks. We do know that 2 doses give full protection, and almost everyone who's received their first dose and has had their second dose come due for Pfizer has received that second dose. That's enormously encouraging that people are going to that point of getting full protection. It's what we want to see, and Victorians are coming out in good numbers for the second dose of both the Pfizer vaccine and the AstraZeneca vaccine. And there are a lot of second doses due for AstraZeneca in coming weeks. So those bookings are in the system, but if you haven't made that booking yet, please do. If you've already got your second dose for Pfizer booked, no change to you. You don't need to go to a different interval, just rock up for your second dose as planned. There are some groups that will stay at the 3-week interval. So, for example, we want our hotel quarantine workers, our border workers, our frontline healthcare workers who work directly with suspected or confirmed COVID cases to receive their second dose at 3 weeks after the first Pfizer dose. The new entrants to these workforces need to be fully vaccinated before they can start, and that's why we're vaccinating our critical and these high-risk workers at the 3-week interval, so that they can roll into their work roles at an appropriate time. Correctional services staff and clients receiving vaccinations on sites will continue to receive their second dose 3 weeks after the first. And the Department of Health will continue to monitor supply and the status of outbreaks when acting on ATAGI advice from now and into the future. A recent outbreak here and the ongoing situation in New South Wales are stark reminders of the need to vaccinate as many people as soon as possible. We do need to protect our entire community from the threat of coronavirus as soon as possible. You'll see more bookings become available in the system in 3 to 4 weeks' time as these changes come in, so look out for those opportunities. We've had 3.2 million doses already delivered here in Victoria and we'll deliver more. Over 1 million people have received their second dose in Victoria. That is terrific news. And then finally, an update to the permit system, travel permit system in Victoria from last night. South Australia and Norfolk Island, that had been red zones, turned to orange zones effective from 11:59 last night, Friday the 30th. People travelling from these areas into Victoria can now apply for an orange zone permit, not red. That means for orange zone permit holders, you must isolate on arrival, get a test within 72 hours, and stay isolated until you receive a negative result. Existing red zone arrivals who are currently in Victoria from South Australia and Norfolk Island, who've had a test since arriving and received a negative result, are also released from quarantine. We're seeing new arrivals doing the right thing with their permits, very high compliance, but checks are in place, meeting all flights from those relevant zones. The permit checks at our borders and for relevant arriving flights continue. We'll obviously review these ratings as we do every day, including for the unfolding situation in Queensland. Thank you. Thanks, Minister. Yeah, it's certainly about the response, and I'm very confident that Victorians will continue to do what they've done right through. So we've got an exposure site, but it's listed only 2 days after the case has been there, so anyone who's potentially exposed will hopefully get the message. We want to reinforce that, so it's the Doncaster Woolies on the 28th in the morning, but check the website. We can absolutely wrap the response around this. It's a single exposure site. Obviously, we want everyone who's been there potentially exposed to quarantine now and get tested. But we had over 400 exposure sites, and there was only a minority of those through the course of this outbreak where transmission actually occurred. It's so good to see again Victorians wearing masks indoors, in shopping centres, in the Woolies and Coles across the state. So you know, there's still a risk. We absolutely want to run down every single person who's a primary close contact here, but it is not something to panic about or to be overly anxious about. We just need to do what Victorians have done so well: identify if you've been a close contact and quarantine, get tested.
With those fragments in the wastewater detected, the 12 fragments on high alert, do you have any update on that development?
There's nothing that's given us a clear explanation for those wastewater detections. Obviously, we've still got some primary close contacts who could be resident there. We've got red zone arrivals who might be resident within those catchments. So there might yet be a case who comes to the fore and we identify a reason for it. There are also a few people who've been released from their isolation because they've recovered as cases. They're free to travel across Victoria as for any other Victorian. That can sometimes be a reason for a positive detection. But of course, we want that call out for anyone, especially in those listed suburbs, to come forward for testing if they've got any symptoms at all.
So you don't think it could be a sign of the potential for the case, here?
There might be a case, but again, all of our red zone arrivals should be quarantining at home. All of our primary close contacts are aware that they need to quarantine for that full 14-day period, get a test before they're released. They might end up being a positive case on that day 13 test, but if they've been in quarantine that whole time, it's not a concern to us.
Just after the change to the Pfizer advice, is it basically an acceptance that we're inevitably going to have another lockdown sooner rather than later?
No, far from it. It is absolutely an acceptance that the more people who can get vaccinated earlier, at the earliest possible time, that we can front load these first doses for Victorians is a higher protection, is a greater protection against the risk of lockdown. We have to accept that the threats will be there for some months to come until we get that very high 70-80% protection. But the more that we can do and the earlier that we can do it, the better off we are.
So why did we not do it earlier then? Are we naive not to do this, say, at the start of winter?
No, the ATAGI advice has obviously been 3 to 6 weeks. We've monitored the epidemiological situation in Australia right through. It's clearly turning. There's a substantial risk coming from New South Wales. Queensland are facing exactly that threat, and so we're acting on the reflections that we have from a public health perspective, that we want the fuller protection, knowing that we've got that uplift in supply in September. Doing it earlier, we wouldn't have had that forthcoming increased supply through July, August. So September uplift in allocation will allow us to do this.
And considering this idea of trying to get as many people at least with their first dose as possible, do you think we should be looking at copying what New South Wales are doing and pushing the AstraZeneca more for people under 40?
Well, we've always encouraged people to get AstraZeneca, certainly if they're in the eligible groups, certainly if they're in the age groups where it's the preferred vaccine or one of the vaccines that ATAGI recommend. But for anyone else, again, we've said follow the ATAGI advice. If there are specific individual circumstances for you that tips in favour of you receiving the AstraZeneca vaccine and you're in the under 40 age group, then have that conversation with your GP.
Just on AstraZeneca, sorry, can I just follow on? And I know I asked you this yesterday, Minister, but the creator of AstraZeneca came out saying Australia's mixed messaging could cost lives. Do you think people have lost confidence in coming forward to get the AstraZeneca?
I just hope that I can prosecute the case. I've received AstraZeneca vaccine as a guy in his 50s. I hope that there are lots of other people who can make that consideration for themselves, certainly for the over 60s. That's the vaccine that's available. We've got a plentiful supply. We've still got just under 20% of people in that over 70s age group who haven't received it, who could receive it tomorrow. So I want to be entirely clear in my messaging that the AstraZeneca vaccine is a terrific vaccine. It is a safe vaccine. There have been some very precautionary constraints or preference for Pfizer for other age groups, but that doesn't mean that it's not appropriate for many people in Australia right now.
Would you change the 5 dosing eligibility if people become available under 40 earlier, considering
I don't know about that. The main change that will happen with this dosing interval change will be that there are a lot more people who can receive that first dose, in coming weeks. I don't think that means that we can open up to under 40s immediately. We can't. We need that much more substantial supply through September, October.
New South Wales today, 210 cases, 138 are aged under 40. Considering where our strategy right now is getting cases down to zero and lockdown, do you think that needs to be a recalibration so that we vaccinate younger people to stop them spreading it around? But I'm focusing only on hospitalisation and vaccinating some of these case numbers down. Would it not be more efficient to reduce the transmissibility of younger people?
Well, that was certainly part of the Doherty modelling, and they've looked at that, and they recognise that getting coverage across the board for all age groups, including that mobile working age population under 40s, is a key way to reduce the risk of transmission. We've obviously gone early with protecting those most vulnerable, those most at risk of severe disease. But yes, the public health approach will recalibrate and will shift, and the under 40s need to be vaccinated. We need to do it as soon as we've got a supply that allows for that to happen.
Queensland's just announced going into lockdown. Will you declare Queensland or those areas a red zone?
Look, I haven't got the full details. Obviously, it's a concern. There are significant numbers already, and the lockdown's been announced. I'll have a look at that today. I've got a pretty strong expectation that I'll need to make changes in relation to the permit zones for South East Queensland.
What would that mean? What would that mean? Then we've got AFL football teams there. Would they then require exemptions to come back to Victoria?
Well, if it goes to a red zone, whoever's in a red zone needs to have an exemption to return if they're not a Victorian resident. So, that applies across the board. Anyone who's outside of those categories needs to apply for an exemption if they're not an accepted person or a Victorian resident.
How concerned are you about the situation in Queensland now?
Oh, it's obviously concerning whenever you get a significant number of cases, or indeed a mystery case, which is what was flagged yesterday. It means that there's transmission that hasn't been picked up or that isn't definitively linked. My understanding is there's a genomic link now back to hotel quarantine cases, but it's concerning to have any COVID cases that you have to chase down when you've got settings that allow for transmission to occur pretty readily. But Queensland's acted entirely in line with the national plan and with the strategy that we've taken in Victoria to lock down quickly.
Just on red zones, is there a reason why Norfolk Island is now orange zone and Lord Howe Island remains a red zone?
Well, Lord Howe Island's part of New South Wales territory. Norfolk Island hasn't had exposure sites cases, and I'm happy that it has that entitlement as an orange zone, that people come back and just get the testing done.
But there haven't been exposures at Lord Howe Island either, I don't think.
No, but the free movement, I guess, of people across regional New South Wales still allows for that, and so it's all under consideration every day, but it's pretty hard to carve out small bits of regional New South Wales without the assurance that there couldn't be new exposures across there.
Do you think we'll actually get to the bottom of where the traffic controller originally caught it? Does that worry you that it's, we know that it's linked, but still in the sense of there's a mystery as to the acquisition, that it might be festering somewhere?
I don't believe so. I think there's a reasonable, if not super high level of confidence that it's been picked up at the testing site, probably from a positive case who came through for testing. That's overwhelmingly the likely explanation, I think. There are really no other acquisition sources for this case, and we've run down all of those other close contacts where it might have been picked up. I will continue to test the remaining people who might be a source for him, but I think it's probably someone who's come through for testing.
And then the second traffic controller, were they both wearing masks when they were sharing the car ride together?
I don't know for the car ride, honestly, but you know, it's a consideration for everyone who's a workmate who's getting a lift.
How concerned are you about the Woolies being such a high traffic area, then that you will see more cases from there?
I don't know that we will. We want everyone to come forward, obviously, but people wear masks shopping. I've seen people do pretty good distancing, and there's lots of hygiene and cleaning measures as well. So we need to do the right thing, find everyone through QR codes and loyalty cards and EFTPOS. But you know, I hope that if there are any new cases that emerge, they're already in isolation.
Something that came out of National Cabinet yesterday, a subgroup of Victoria, Northern Territory and Tasmania is going to work on what restrictions vaccinated people might be able to enjoy, whatever it may be. Do you have any initial thoughts or leanings on what that might look like?
Oh no, I think that's so. The idea that some vaccinated people have greater freedoms or greater opportunities for travel or for attendance at events needs to be worked through. No initial thoughts. I think it's really important that there's a group working across Australia to go to those detailed considerations. I think it'll be, in part, it'll be a driver for people to get vaccinated if they have been hesitant, and it's a reflection of a lower risk of transmitting to others, and so it should rightly be considered.
Do you think that'll have to come hand in hand with some kind of vaccine passport, proof that people carry around that they have been vaccinated?
I suspect so. It seems to be what's happened across the world in terms of being able to provide greater freedoms or opportunities for vaccinated people. But that'll be worked up through the process.
And why those three? Why Victoria, Tasman and Northern?
Oh, I'm not sure. I wasn't at National Cabinet. I presume they put their hands up and are very pleased to be working on some of those details.
And can you give us any update on, I might be the Minister, on Victorian contact tracers or other health workers potentially going to help in New South Wales? Have we received the request for that recently?
I will. I'll play the minister.